Hi everyone. Today in this video we are going to discuss about Cinnarizine. What is Cinnarizine? This drug mainly acts on the central nervous system and it acts as antihistamine as well as anti-dopaminergic agent. It can also block voltage-gated calcium channels, potassium channels, and even it can affect serotonergic transmission. So it is having multiple mechanisms of actions. All are attributed to its central action. This drug can be used in the management of labyrinth disorders which are associated with vertigo, tinnitus, postural imbalance, nausea and vomiting. And this drug can also be used in the treatment of motion sickness where there is increased emesis, nausea and vomiting in the patients who are traveling in a vehicle, again because of disturbance in vestibular system. Similarly, this drug can also be used in migraine prophylaxis where it can control the nausea and vomiting associated with this migraine stimuli. So this drug can be used in the labyrinth disorders such as vertigo where there is a reeling sensation, and it can also be used in the ataxia, loss of balance, and some budgie noise in the ear, that is tinnitus. In all these conditions this drug can be used. Even the drowsiness, dizziness or any disorder that is associated with this vestibular system that can induce either nausea, vomiting, drowsiness, dizziness, vertigo, all these things can be controlled by this Cinnarizine. And this drug can also be used in the peripheral circulation disorders such as Raynaud's disease, paresthesias, loss of sensation, varicose ulcers, night cramps. All these can be controlled by Cinnarizine because this drug blocks voltage-gated calcium channels, thereby it produces vasodilatation. Even this drug is mainly intended for its central action. It can also be used for if you have the peripheral circulation disorders. So today in this video we are going to see what is the mechanism of this Cinnarizine, how this drug acts, what are the important precautions, side effects and doses we will discuss in this video. First of all, let us see the chemical nature of this drug. So this is the structure of Cinnarizine. The suffix "zine" indicates it is having one of the heterocyclic ring system, that is nothing but piperazine. So Cinnarizine is a piperazine derivative and this piperazine ring is attached to another ring system through a methyl carbon. So this ring system is nothing but benzhydryl ring system which is attached at the first position of piperazine. So we can write this as 1-benzhydryl. Similarly, at the para position, that is the fourth position, a propyl chain is present with a double bond within the chain. So let us give the numbering to this chain. So this is 1, this is 2 and 3. So a double bond is present at the second position. So it is a propene 2-aryl chain. This chain is attached at the fourth position of piperazine ring. So we can write this as 4-prop 2-1-aryl. And to this ring at the third position phenyl ring is present. So 3-phenyl. That is the complete name of Cinnarizine. Now let us see how this drug acts. Cinnarizine mainly inhibits voltage-gated calcium channels on the cerebral blood vessels. So these blood vessels are expressed with voltage-gated calcium channels. Now the calcium can enter through these channels which produce contraction of the vascular smooth muscle. Because of reduced cerebral blood flow, there may be imbalance within the body resulting in vertigo, nausea, ataxia in the patients. In such conditions, Cinnarizine can be given which can block these voltage-gated calcium channels resulting in vasodilatation. Now this vasodilatation can increase cerebral blood flow. When the blood flow to the cerebral system increases, the balance of the body is going to be improved. In this way, Cinnarizine can control the symptoms associated with vestibular disorders such as vertigo, nausea, tinnitus and ataxia in the patients. Similarly, Cinnarizine can also block the potassium channels on the vestibular hair cells. Vestibular hair cells are expressed with potassium channels. So when there is elevated hydrostatic pressure, these potassium channels are activated. Similarly, these hair cells are also associated with calcium channels. Under elevated hydrostatic pressure, the potassium can enter through these potassium channels which produce a depolarization. This can further increase the entry of calcium. So now calcium can enter through these calcium channels which produces further depolarization and release of neurotransmitters. So these neurotransmitters can produce neuronal stimulation which may produce some imbalance in the body. In such conditions, again Cinnarizine can be given. This drug can block these potassium channels so that it can prevent neuronal stimulation. In this way, this drug can prevent the symptoms associated with postural imbalance. Apart from these mechanisms, this drug can also act as antihistamine by blocking the H1 receptors, where it can reduce any allergic response, and it can also block dopamine receptors, which sometimes may lead to Parkinson-like symptoms in the patients. What are the precautions? One of the important precautions of Cinnarizine is that this drug can produce some epigastric distress. So it can produce epigastric distress and pain in the patients, which increase gastric irritation as well as dyspepsia. So this drug should be given better after the meal. So when this drug is administered after a meal, it can reduce epigastric distress within the patients. Similarly, this drug can increase some Parkinson-like symptoms in the patients. So if already patient is having any Parkinson disease, this drug should be carefully given. This is because of its antagonism on dopamine receptors. So this drug can increase some tremor in the patients, muscle rigidity and dyskinesia. So care should be taken in the patients with any prehistory of Parkinson's disease. Similarly, this drug mainly affects the central nervous system, where it can produce some drowsiness in the patients as well as dizziness. So when this drug is given along with alcohol or other CNS depressants, it can further increase the drowsiness in the patients. So care should be taken to avoid any other CNS depressants with Cinnarizine. Another important precaution is that this drug can increase the porphyrin levels, resulting in porphyria. Porphyrin is a precursor for hemoglobin. So when these porphyrin levels are excessively increased, it results in porphyria, leading to few of the symptoms such as abdominal cramps, nausea and vomiting. Some muscle weakness and dark colored urine can be observed in the patients. And in the patients with any liver dysfunction, this porphyria is further increased. So care should be taken in the patients with risk factors for porphyria. What are the side effects? The important side effects mainly include dizziness, drowsiness, lethargy, some weakness, and some sedation. It can also increase the weight, resulting in weight gain, some GI discomfort and epigastric distress, leading to epigastric pain, dyspepsia, and hyperhidrosis. It can produce excessive sweating in the patients, some fatigue, dyskinesia, disturbance in the motor movements, and muscle stiffness can be observed in the patients. How it is given? This drug is available as tablet at 2 strengths 25 mg as well as 75 mg, and it is also available as oral suspension. The tablet is a widely used form. For the management of cerebral and balance disorders, this drug is given at a dose of 25 mg administered 3 times daily. But for peripheral circulation disorders, this drug is given as 50 to 75 mg given 3 times daily. So for peripheral disorders, the dose is increased in order to produce significant peripheral vasodilatation. But nowadays, this drug is more preferred for central disorders such as cerebral and balance disorders. So that's about this drug Cinnarizine, which is a centrally acting antihistamine as well as anti-dopaminergic agent. This drug mainly blocks voltage-gated calcium channels on the cerebral blood vessels, resulting in the cerebral vasodilatation, and it can also block potassium channels on vestibular hair cells, thereby it can reduce neuronal stimulation. By all these actions, it can reduce few of the symptoms such as vertigo, tinnitus, ataxia, nausea and vomiting, and even other symptoms associated with motion sickness as well as migraine. So in all these conditions, this drug can be used. Drowsiness and weight gain are the two important side effects of this Cinnarizine. So that's about this drug Cinnarizine. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.